Hi everyone, I'm here with Dr. Anitha Bhat. She is a local geriatrician and internal medicine new to our high desert community. Her office is conveniently located near Jess Ranch, and today we're going to talk about urinary incontinence.
Hi everyone, thank you for that lovely introduction. So like Renee said, my name is Dr. Bhat. I am part of Kamath Medical Group and one of the doctors in the Choice Physicians Network. And I'm here today to talk to you about urinary incontinence, a very important topic, I think, for a lot of older adults.
Thank you, Doctor. So my first question for you is, what exactly is urinary incontinence?
Okay, so that's a really good question. The way I describe urinary incontinence to my patients is it involves kind of unintentional or accidental leakage of urine before you actually are able to urinate in a urinal, toilet, whatever, whatever you typically void in. So it's an important topic for older adults because it's common, but it's not something that's often addressed. And it can have significant effects on quality of life as well as kind of your overall health. From here on out, I'm specifically talking about urinary incontinence, but I'm just going to refer to it as incontinence going forward.
Okay, what causes urinary incontinence?
Yeah, so certainly younger adults can also have incontinence, but they tend to have incontinence for different reasons compared to older adults. So just briefly, for younger adults, oftentimes there's some sort of problem in the urinary tract, which is causing them to have leakage of urine. In older adults, it's a little bit more different, and the actual process of urination is actually more complicated than you might think of. It is important for people to know that urinary incontinence is not considered a normal part of aging. Certainly there are changes to our bladders as we get older, which may predispose us to having incontinence, but in and of themselves do not cause incontinence, okay? So just kind of going back to the process of urination, it is something that is a little bit more complicated than you might initially think. It involves a lot of precise coordination between your brain, your bladder, and pelvic muscles. There are also other factors that play a role in being able to urinate, including having a functioning urinary tract system, being able to recognize when you need to urinate, being motivated to actually go to the bathroom when you feel that urge, also having the mobility to walk to the bathroom, be able to sit on the toilet, as well as manual dexterity to kind of dress and undress as needed as well. Oftentimes, for older adults, there is some sort of problem in one of those or more of those areas.
Are there different types of urinary incontinence?
Yeah, so when we start kind of investigating urinary incontinence, we try to categorize it based on what we think is causing the incontinence. So incontinence may fall into a couple of different categories. There's a type of incontinence called stress incontinence, where people experience leakage of urine because of increased pressure in their abdomen. So this is a type of incontinence that you may get, leakage that may happen if someone coughs or sneezes. A second type of incontinence is called urge incontinence, and it's typically described by a really powerful sense that you need to use the bathroom, but within a minute or two of having that sensation, you start experiencing leakage. Of course, for this type of incontinence, there can be reasons for having the symptoms. One of the more common reasons is like overactive bladder, where you have frequent kind of contractions of the bladder, okay? The third type of incontinence is called incontinence with impaired bladder emptying. So in that type of case, there's either some type of obstruction or blockage that's preventing urine from passing through the urinary system up to the outside, or the bladder itself is weak and can't squeeze forcibly enough to push the urine out into the environment, or it could be a combination of both. So these types of categories are used to help us kind of categorize the incontinence. It doesn't always explain exactly why people have it. Sometimes that requires further investigation. And the other thing to realize is that incontinence can also be related to issues like other health conditions that a person has, such as swelling in the legs, medications that people are taking as well.
Interesting. When should patients see a doctor when they have incontinence?
So, there's some statistics out there that say that 50% of patients have incontinence but don't ever bring it up to their doctors. Again, I really want to emphasize that incontinence is not just a part of normal aging, that it is treatable and can be improved upon. I think it really is a question of quality of life. If you feel that incontinence is significantly affecting your quality of life, or is causing some adverse health issues such as frequent falls, it's certainly a topic that needs to be addressed with your doctor. I also would say that if you suddenly develop incontinence, that's another scenario in which you really do need to discuss this problem with your doctor.
Thank you, Dr. Bhat. You gave a lot of information about urinary incontinence. I hope that everyone watching at home learned a lot. If anybody would like some more information from Dr. Bhat, she is accepting new patients, so please give her office a call. She is accepting most health insurances.
All right, thank you for the opportunity for allowing me to speak about this topic.
Thank you, doctor.
Thank you very much. Have a good day.